Hey, what's up, guys? Welcome back to the channel. In today's video, we're delving into the realm of non-invasive positive pressure ventilation, abbreviated NPPV. Our attention will be directed towards the two most prevalent devices, BiPAP and CPAP. If you have ever contemplated the discrepancy between these two entities or pondered the circumstances when one might be more desirable than the other, you have come to the right place. So, pull up a chair because we are about to dissect everything. Are you all set? Come along now. Both BiPAP level positive airway pressure and CPAP continuous positive airway pressure are employed to aid individuals experiencing difficulties with breathing, commonly in situations such as sleep apnea or respiratory distress. Even though they both enhance airflow and oxygen levels, they achieve this through different methods. Understanding these variances can greatly assist you in making an informed decision, regardless of whether you are a patient, caregiver, or simply someone interested in respiratory health. In this video, we will explore the operations of each machine, understand their purpose, and distinguish their unique features. By the end, you will acquire a thorough comprehension of when to utilize CPAP versus BiPAP and how they can significantly impact an individual's breathing and overall comfort. If you're eager to delve deeper into these essential devices, simply hit the like button and let's begin. What exactly is non-invasive ventilation? Non-invasive ventilation is a technique that delivers positive pressure ventilation without requiring an artificial airway like an endotracheal tube. The primary objective of non-invasive ventilation is to prevent the necessity for intubation, ultimately resulting in fewer complications compared to traditional mechanical ventilation. The two main types of non-invasive ventilation there are two primary types of non-invasive positive pressure ventilation, BiPAP and CPAP. We're here to dissect both concepts and assist you in grasping their distinctions. Before we delve into the specifics, here are a couple of key points to understand about non-invasive ventilation overall. The fundamentals of non-invasive ventilation settings are centered around two main aspects: IPAP inspiratory positive airway pressure and EPAP expiratory positive airway pressure. IPAP represents the pressure above zero at the inspiratory phase of breathing. It operates in a comparable manner to peak airway pressure PAP utilized in traditional mechanical ventilation. By adjusting the IPAP setting, you can enhance the tidal volume, which is the air amount directed to the lungs. During the expiratory phase, EPAP refers to the pressure that is above zero. It operates much like PEP positive end expiratory pressure in standard ventilation, and in non-invasive ventilation, it enhances oxygenation by boosting the functional residual capacity. Adjusting these settings, IPAP and EPAP can assist in controlling a patient's respiratory and oxygen levels. Now, let's delve into some typical signs that suggest the use of non-invasive ventilation. Common indications for non-invasive ventilation. Some common conditions where non-invasive ventilation is used include severe dyspnea, difficulty breathing, acute respiratory failure, acute exacerbation of COPD, chronic obstructive pulmonary disease, congestive heart failure, pulmonary edema. To avoid reintubation in a patient recently extubated obstructive sleep apnea OSA, however, non-invasive ventilation should not be used for patients who are critically ill or unstable. Let's delve into CPAP, an abbreviation for continuous positive airway pressure. With CPAP, positive pressure is delivered continuously throughout the entire breathing cycle. It is essential to mention that CPAP is suitable only for patients breathing on their own, as it does not involve any mechanical breaths. CPAP operates by ensuring that the IPAP and EPAP pressures are set at the same level. This signifies that the inspiratory and expiratory pressures are equal, ensuring a constant positive airway pressure. The main reason for using CPAP is to treat obstructive sleep apnea OSA. OSA is a condition where a patient experiences multiple episodes of apnea, no breathing during sleep. These brief pauses in breathing usually persist for a minimum of 10 seconds and happen repeatedly during the night. CPAP assists in maintaining the airway open while sleeping, thus preventing airway collapse and decreasing occurrences of apneas. Many patients with obstructive sleep apnea rely on wearing CPAP masks while sleeping at night. However, CPAP does have some contraindications, apnea and hypoventilation. Since CPAP requires the patient to breathe spontaneously, it's not suitable for those who are not breathing on their own. Respiratory muscle fatigue. Patients experiencing excessive fatigue that hinders their ability to breathe properly may struggle to tolerate CPAP. Facial burns or trauma can make it challenging or even impossible for a patient to use a CPAP mask. Claustrophobia. Some patients may experience feelings of being suffocated or anxious while using the CPAP mask. CPAP is utilized in traditional mechanical ventilation for transitioning patients off the ventilator, enhancing the weaning process. When using CPAP, it is important to closely observe the patient for signs of fatigue, as they are primarily responsible for the minute ventilation. Please rewrite this text in a more smooth manner. Add to line breaks where necessary. Signs of fatigue can include increased dyspnea, shortness of breath, tachycardia, increased heart rate, rising PaCO2 levels, carbon dioxide buildup, increasing respiratory rate, decreasing tidal volume and vital capacity. If any of these signs manifest, it may be necessary to transition the patient from CPAP to a traditional ventilation mode. Let's gently transition to discussing BiPAP, bi-level positive airway pressure. This term actually stands for bi-level positive airway pressure. Unlike CPAP, BiPAP operates with two distinct pressure levels: IPAP inspiratory positive airway pressure and EPAP expiratory positive airway pressure. IPAP manages the tidal volume, effectively aiding in pushing air into the lungs. EPAP operates similarly to PEP positive end expiratory pressure, ensuring that the airways remain open while exhaling and enhancing oxygen levels. BiPAP is mainly utilized for the specific conditions: acute respiratory failure, acute exacerbation of COPD, especially in cases where blood gases reveal problems such as low pH and high CO2. For cardiogenic pulmonary edema, BiPAP has shown to be highly effective in decreasing the necessity for invasive mechanical ventilation. Nevertheless, similar to CPAP, BiPAP also has contraindications. These include apnea, unstable secretions, facial burns, or trauma. And claustrophobia. BIP and CPAP therapy both necessitate the use of a mask to provide treatment. There are various types of interfaces. 1. Nasal mask. This type of mask is designed to cover solely the nose. It is frequently utilized in conjunction with CPAP therapy for individuals with sleep apnea. The main issue with this mask is that individuals who breathe through their mouths may encounter air leakage, potentially leading to nasal dryness. Please rewrite this with a smoother tone and add quotags where a line break is needed. 2. Oronasal mask. This mask covers both the mouth and the nose. When utilized in BiPAP therapy, the full face mask often offers a superior seal compared to the nasal mask. However, it is important to note that this may potentially elevate the risk of aspiration or regurgitation. Please add to break tags where necessary. 3. Nasal pillows. These consist of small prongs that are gently inserted into the nostrils. They are the tiniest and most comfortable choice. However, they might lead to nasal congestion or nosebleeds. They are usually not advised for BiPAP. Please add to line breaks where necessary. 4. Full face mask. This mask envelops the entire face. It is typically employed when other masks have been unsuccessful in stopping leaks. Although it's the most effective in preventing leaks, it's also the least comfortable. Adjusting the IPAP and EPAP settings to meet the patient's needs is referred to as titration. A typical starting point is a setting of 10/5 IPAP 10, EPAP 5, but this may vary based on the patient's condition. IPAP settings typically vary between 8 to 12 centimeters of water pressure. EPAP settings usually fall within the range of 4 to 5 centimeters of water pressure. Adjustments can be finely tuned in increments of 1 to 2 centimeters of water pressure. For instance, if the patient requires a higher tidal volume to facilitate the removal of CO2, you may consider raising the IPAP. To enhance oxygenation, consider raising the EPAP pressure, which is akin to increasing PEEP. Now, you should have acquired a thorough comprehension of BiPAP and CPAP, including their similarities, variances, and the specific circumstances in which each type of therapy is recommended. If you found this video helpful, please remember to hit that like button. It truly makes a difference in supporting the channel, and your support is truly valued. Each like received is truly meaningful, as it enables us to connect with a wider audience in need of this valuable content. Don't forget to subscribe so you're the first to know when we release new videos. We've got some exciting topics coming up that you won't want to miss. Thank you so much for watching, and I hope you found the information useful and inspiring. I'm thrilled to share that I will be providing even more valuable content in the days ahead. Take care, and I'll see you in the next video. Always remember to take a deep breath, my friend.